Greetings, welcome to UNC Charlotte. We are the College of Health and Human Services, and we are so excited that you are here to learn more about us. I am Demetrius Richmond, the Director of Advising, and we're so happy to have you. And so we want to talk about today our programs, the overall college. We have about 2,000 undergraduate students and about 1,500 graduate students. And our college is comprised of the Department of Kinesiology, the Department of Public Health Sciences, the School of Nursing, and the School of Social Work. And so this talks about what is the advantage of choosing our College of Health and Human Services over others. We believe that we stand out above the pack for these reasons: for our nationally accredited programs, our interprofessional or interdisciplinary approach to education. We pride ourselves on training high quality, highly prepared healthcare and human services professionals, and we do that through an experiential education model. Our clinical education experience is also with leading healthcare facilities, and our students have access to renowned research labs, hospitals, and healthcare facilities in the Charlotte area. So that's a little bit about who we are. Like I said earlier, we pride ourselves on training highly prepared, highly trained healthcare professionals and human services professionals. Our students must make above a C in most of their classes, so performing well is very important for student success in our college. Our students engage in a basic applied and public health foundation that gives them a comprehensive experience in the healthcare and human services field and then helps them focus more specifically into their areas, and we pride ourselves on that. I want to go over our undergraduate programs to give you a little bit more specifically what our majors are. This gives you an overview of our undergraduate degrees. And so as you can see, we have a Bachelor's of Nursing program that trains leaders and nurse clinicians. It's a 4-year program. We have a Public Health Bachelor's of Science and a Bachelor's of Science in Health Systems Management. Those both are 4 years also with an early entry, which means they can apply early to start their master's and get a master's within a year. And so our students take advantage of that. Our kinesiology department has a Bachelor's of Science in Exercise Science, which also is 4 years with an early entry. And of course, our Bachelor's of Social Work is a 4-year program. And as you can see, the BS in Exercise Science and Social Work have internships, supervised clinical education, clinical placements, and also a 2+2 online program. So again, you see that real-world experience with our degrees. When our students are admitted into the College of Health and Human Services as first years and as transfers, they are admitted as a pre-major, which means they are not in the major yet. With the exception of our health systems management, they are not pre-majors, but all of our other majors are admitted as pre-majors, and they must complete general education courses and prerequisite courses for their specific majors before they apply to the upper division of their major. So now let's take a quick glimpse at each of our degrees so you learn a little bit more about them. We're going to start out with our Bachelor's of Science in Exercise Science out of the Department of Kinesiology. This BS in Exercise Science is a degree program. It focuses on the study of bodily movements that contribute to human fitness, holistic wellness, and longevity. When you're looking at careers with this degree, you can be a variety of things as you see on the screen. Kinesiologist, massage therapist, athletic director, and athletic trainer, strength and conditioning coach. This is a great path for people who want to go on to graduate school. We're going to talk about that a little later also. In terms of applying to the major, you must have a 2.5 GPA minimally. You must complete all of the pre-kines courses to apply into the major with a C or higher. So you can take courses like A&P, Anatomy and Physiology, Chemistry, Biochemistry. These are science courses that are going to lay the groundwork for your major courses. There's also a written essay that you must submit when you submit your application to the upper division. Once you're in the major, there's also a 340-hour internship experience that's required for all students. And as I said earlier, this program is a popular pathway for people who want to go on to become physical therapists, physician assistants, occupational therapy, and even medical school. And so it's a great foundation to move you into those paths. And so if you have more questions, Julie Marino is the program coordinator for their program, and she can answer more specific questions about the curriculum and things of that nature. Moving on to our Bachelor of Science in Nursing. This is a popular program in our college. Again, it trains nursing leaders. To apply for admission, you must have a minimal 3.0 or higher for a GPA. You must have a B in all of the prerequisite courses, which includes the sciences. Again, anatomy and physiology 1 and 2, chemistry, biology, all the science prereqs you must have at least a B in to be admitted into the upper division. You must have documentation of work or volunteer experience of how many? 50 hours or more. And it must be in a healthcare setting, and it must also be with direct patient care. So it can't be sitting at a desk. You must be engaging with patients with that 50-hour requirement. You also must have at least 30 earned credit hours right here at UNC Charlotte before you are admitted. And you must also have a CNA licensure, which is a certified nursing assistant licensure, before you start your nursing courses. This is a fairly competitive program. As you can see, we admit our top 50 students each semester. And if you have more questions about the nursing program, you can contact Dr. Susan Lynch in nursing. Our next degree is our Bachelor's of Social Work. We call this the helping profession. It trains you to work in a variety of fields related to mental health, social issues, and it can be in a variety of degrees and majors: child protective services, substance abuse treatment, hospitals, youth and children's services, criminal justice. These are all career pathways that you can get with this degree in hand. When you look at the program and admission, you see the deadline is February 1st through July 1st. You must have a 2.5 GPA minimally. Social work admits about 60 to 75 students each year. There is a myriad of courses you must take to meet the prerequisites. There's also an honors program with an emphasis on research that really gives you more skill set in addressing issues. And as we talked about the experiential learning, our students are placed in field placements during their senior year in real-world social work settings where they're supervised by licensed clinicians their senior year. So again, they're getting real-world practical experience. If you have more questions, check out the website. Some of our students also elect to do the early entry into our Master's of Social Work degree, where they can get a master's with an additional year of work, which gets you more prepared for the field. And of course, Dr. Sonia Richardson is the program coordinator. If you have questions for her about the program, please don't hesitate to contact her. Moving on to the public health, which has 2 degrees in this department. We'll start out with our Bachelor's of Science in Public Health. This is a professional degree that focuses on health and disease within populations, which includes prevention, education, and surveillance and policy. So public health is one of our growing degrees as well. This lists some of the potential career paths in health and public health sciences: dietitian, an epidemiologist, a health educator, a community health worker. These are all amazing pathways that our students go into with this degree. When you look at admission, again, a 2.5 or higher, students must complete 60 credit hours of pre-public health courses. This lists some of those. You see a little science there. You see healthy lifestyles, foundations of public health, global issues, a little math, and some social sciences to go along with it. When you apply to upper division, there is an application process and a goal statement that you must submit. And Dr. Pilar Zuber is the program director for that. So if you have questions, please contact her as well. And finally, we're looking at our Health Systems Management Bachelor's of Science. This is a newer program that is growing very rapidly. It is a program that really gives students entry-level access to the field of healthcare from a systems management approach. When you look at healthcare, there is an infrastructure. There are systems in place whether it's insurance or IT or whatever. This degree really gets you access and trained for those careers ranging from health insurance manager, physician practice manager, quality improvement manager, patient finance manager. So a lot of our students want to stay in the healthcare field, but they want to work more in other areas as well. As I said earlier, this is the only major that does not require a pre-major designation. And so this makes it very popular. 30 credit hours to be admitted, a 2.0 GPA, and you can contact Miss Chelsea Demarest, the program coordinator for this one. Okay, we just talked about our degrees. I want to talk very quickly about the student experience here in the College of Health and Human Services. We pride ourselves on creating an environment where our students are supported. You know, UNC Charlotte is a very large institution, but we create an intimate setting for our students in CHHS, and we do that with a variety of efforts. We first want to make sure our students are socially integrated and academically integrated, and we do that with a variety of efforts. The first one is our first year seminar. We call it Prospect for Success. It's a course for all incoming first year students, freshmen, and they sit and they meet with each other every week with the faculty member and talk about how do you acclimate to college? What are your challenges? What is your learning style? What is your time life management skills? These are very important as our first year students acclimate into being adult learners in a college setting, and it's very successful for our students in making sure they have a great experience their first year. Another effort to ensure our students are acclimated is our Health Connections learning community. This is a living learning community where students actually live together and they learn together. And so how does that work? Students live in Lynch Hall. We accept about 44 students who apply. They take 2 to 3 classes together. They also do service learning projects where they go out into the community and do some type of service, come back and process and learn more about it. They have individual academic advising and early contact with our faculty. And so again, this is another opportunity for our students to get a high impact experience to ensure their success. I talked about our clinical experiences earlier. We pride ourselves on the fact that our students are placed in real world settings fairly early and in a high intense manner. And so we have about 600 plus affiliated agencies that we place our students in, whether it's clinical placements or whether it's internships across the region. Major hospitals, health departments, schools, hospice, home health, mental health agencies. Our students are displaced or placed across the region and getting real world experience in these areas. We also have high impact, cutting edge labs right here in our CHHS building where students are getting real-time simulation experience. We have the Health Risk Assessment Lab. It offers insight into biological health. We can do comprehensive panel of physical and physiological tests for patients who want to figure out what their health assessment is. If you click the title Health Risk Assessment, it'll take you to a video, a tour of the lab itself. Our next lab is the Nurse Simulation Lab that we call the Learning Resource Center. This is where our nursing students get a lot of simulation of being in a high impact, high intense environment. And so it simulates a hospital, it simulates a house where students get equipped to be highly prepared nurses. And again, if you click the Nursing Lab Learning Resource Center title, it'll take you to a video that gives you a tour of their cutting edge lab as well. And so I'm going to wrap this up. So again, we are the College of Health and Human Services. We are so excited that you're interested in us. If you have questions, please don't hesitate to contact us. But please know that there's a place for you in the College of Health and Human Services. We look forward to seeing you. Thank you.